Being recorded.
Good evening and welcome to the NYC Health and Hospitals Fiscal Year 2022 Virtual Annual Public Meeting for the Borough of Queens. Good evening, ladies and gentlemen. Before we start the formal program, I would like to call to your attention that we have interpretation services. If you require these services, please call 212-788-3359. That's for Spanish, Mandarin, and Bengali. Thank you. The phone number again is 212-788-3359. My name is Jose Pagan. I'm the chairperson for the board of directors. I want to thank you for joining us and would like to introduce the other board members who are here tonight. Dr. Vincent Calamia, City Council Representative for Staten Island. Robert Nolan, City Council Representative for the Bronx. Barbara Lowe, City Council Representative for Manhattan. Dr. Patricia Martone, City Council Representative for Brooklyn. Erin Kelly, presenting Deputy Mayor Ann Williams Eisen. Commissioner Gary Jenkins, Dr. Michael McRae, Dr. Fenioski Peña Sally Hernandez Piñero, and Dr. Mitchell Katz, President and CEO of the corporation. Also on the panel are Blanche Grenfield, Deputy Counsel and Moderator for the evening, and Colicia Hercules, Secretary of the corporation. I would like to acknowledge the following individuals who are participating in a listening capacity. New York State Senator Toby Ann Stavisky, 16th District. New York State Assembly Member Brian Barnwell, District 30. New York State Assembly Member Jeffrey Aubrey, District 35. NYC Council Member Natasha Williams, District 27. Stancy Saji, Deputy District Director on behalf of Congresswoman Grace Meng, District 6. Mikhail Fuchs, Director of Communications representing Council Members Vicky Palladino, District 19. Special Assistant to the Deputy Chief of Staff, Gina Bittner, on behalf of Queensboro President Donovan Richards Jr. So, on behalf of the board, I would like to extend our thanks and acknowledge the leadership at our Queens facilities, Elena Arteaga Landaverde from Elmhurst Hospital, and Neil Moore, Queens Hospital, the dedicated staff for providing exemplary service to our public health system and the people we serve. And to all of you here, thank you for your support as we strive to provide equal access to safe, affordable, quality care to all. Now I will turn the microphone over to the President and CEO, Mitchell Katz, to continue with his remarks.
Thank you, Dr. Pagan, and good evening, everyone. In March, we marked 2 years since New York City Health and Hospitals admitted our first patient with COVID 19. And of course, the 2 years is particularly poignant in the case of Queens because Elmhurst was the epicenter of the epicenter. And I will forever remember, the night that they called me to say, we have just intubated 16 patients in the last 2 hours in the emergency room at Elmhurst. On a typical difficult day in a hospital like Elmhurst, you may have to intubate 2 people. And in 2 hours, they had intubated 16 people. And it was clear at that moment that we were on the verge of something horrible that none of us had ever lived through, and God willing, none of us will live through again. It was horrible. Queens Hospital followed Elmhurst in terms of severity. We had, and I know many of the elected representatives are on those calls. They were a huge bright part in dealing with the pandemic. People came, people did amazing things to support Elmhurst and Queens, and we'll be forever grateful. Since those darkest days, we had 3 more cycles of COVID, each a little different. And even now, we are more than 2 years dealing with a subvariant of Omicron and seeing more infections, but now a decoupling with serious hospitalization. So while cases are continuing to go up, we are not seeing patients in the ICU with severe COVID. and that is a wonderful, wonderful thing. During these 2 years, I think New York City has learned what an amazing organization health and hospitals is. As we were so our staff so resilient, so brave, so creative. We provided more than 10.5 million COVID tests at our hospitals and clinics and outside sites. By the end of March, we had done more than 100,000 vaccines. And each time a new population um, was eligible for vaccines, New Yorkers learned that the only place, only hospital system where anybody could get an appointment, regardless of whether you were a patient of ours, was at New York City Health and Hospitals. We opened 3 COVID centers of excellence in Bushwick, Brooklyn, Tremont, Bronx, and of course Elmhurst, Queens, where several of us came to see the beautiful center that's just a few blocks away from Elmhurst. Our test and trace corps identified 1.7 million contacts. We helped 33,000 people isolate at a quarantine hotel. And I say that, I want to tell you that no other city in the US had a quarantine hotel for people who were positive and did not want to expose their families. We delivered more than 2.2 free meals to those in isolation. We brought people their medicines. We walked their dogs. We did whatever was necessary to try to keep people safe. And um, people noticed our efforts um, and gave generously to support our staff so that we could have wellness activities. Those wellness activities included things as basic as having washing machines to clean people's scrubs and meals when none of the available restaurants were open. We have created in the recent months show mobile units where we use a mobile van in order to be able to vaccinate homeless people, and that we have found that to be a huge advantage. We also now are the only city in the U.S. where you can call a number 212 COVID-19 and get connected immediately to a emergency department physician or physician assistant or nurse practitioner and assessed if you're positive for a COVID test, whether that's at home or at a lab. We will arrange for you to get the antiviral Paxlovid or a monoclonal infusion. We do this again in our tradition. It doesn't matter whether you're our patient or not our patient. If you are in New York City, you are our patient. It doesn't matter whether you have insurance or don't have insurance. Our services are proudly offered regardless of immigration status, regardless of insurance. We offer it to all. In terms of specific Queens news, I couldn't be happier with our 2 amazing new CEOs, both of whom are just fantastic administrators and wonderful people to know. Helen Ortega Landaverde at Elmhurst and Neil Moore at Queens. Both had long associations with our hospitals, and I cannot imagine 2 better hospital CEOs. We opened our Center of Excellence in Jackson Heights. Our 2 hospitals were rated as high performing hospitals. Queens Hospital was ranked as one of the most racially inclusive hospitals nationwide. We expanded our orthopedic department at Queens with a new total hip and knee replacement center. In an amazing story, a local businessman, Harry Haraharan, donated $1 million to New York City Health and Hospitals Queens based on his experience of getting vaccinated at that hospital, and was so impressed at the how professional and kind and efficient our staff was, that he wrote us $1 million check. Um, Thanks to the amazing Queensborough President Donovan Richards, we received $5.5 million in funding to support the construction of a new pediatric intensive care and two ORs that will be at Elmhurst. Elmhurst launched a pet therapy program, and we commemorated the 20th anniversary of 9/11 and recognized the essential work of the specialized care teams in our dedicated center of excellence, the World Trade Center Environmental Health Center. So, despite the challenges of COVID, we did other positive health services for the city that we all love so much. And we're looking forward to hearing the comments from the audience today. We only wish we were all together in person and hope we soon will be. Thank you.
Good evening, everyone. Thank you for the online prompting. I appreciate that. So, good evening, everyone. Sorry for that. I missed it. My microphone is now on. Before we start the formal program, if you've just joined us, we want to remind you that we have language translation services available in Spanish, Bengali, and Mandarin. And if you require these services, please call 212-788-3359 and someone will assist you. Thanks, Dr. Katz. My name is Blanche Greenfield, and I am Deputy Counsel here at New York City Health and Hospitals. Due to COVID 19 public gathering restrictions, we are convening the Fiscal Year 2022 public hearing for the Borough of Queens virtually. This is the third in a series of 5 meetings conducted annually across the city's 5 boroughs. The purpose of the annual meeting is to inform the public of the programs and plans of New York City Health and Hospitals, as well as to afford you, the public, an opportunity to present oral and written testimony concerning New York City Health and Hospitals' performance. Public testimony, both oral and written, will be transcribed and forwarded to all of the members of the Board of Directors for their consideration. Please note that registration for testimony is currently still available until 6:30 this evening by calling 212-788-359. I will moderate the balance of tonight's meeting, during which the members of the public are invited to share their comments and concerns about New York City Health and Hospitals. At this juncture, I will briefly highlight the format and rules for the testimony. The most important point to understand is that members of the Board of Directors are here to listen to you, not to engage in a dialogue. This is not a question and answer format. In order for each registered speaker to have an opportunity to testify, registered speakers are allotted 5 minutes of speaking time. On your screen, there is an electronic timer that will provide warnings about the expiration of your time. A yellow light will indicate that the speaker has 2 minutes remaining in their allotted time. A red light will signal that the speaker's time has elapsed, and a flashing red light signifies that the speaker has exceeded their time allotment. We have a full program this evening with a large number of registered speakers, so I will be holding everybody to the 5 minute time limit. If you do not complete your comments within the allotted time and you have a written statement that constitutes your full remarks, you may submit your full comments by calling 212-788-3359 and making arrangements to submit the full statement into the record. Written testimony, along with the transcript of your oral presentation, will be shared with the members of the Board of Directors. Kindly note there is no transferring of your time to another speaker. Finally, I'm going to apologize at the outset if I mispronounce any of the names of the speakers. Please correct me, and I will try again. Thank you for your participation, and we look forward to hearing your views. We will now hear from the first presenter, who is Jessica Gonzalez Rojas, New York State Assembly Member, 34th District.
Hi, thank you so much for having me. I won't take the whole number of minutes that was allocated, but I really wanted to thank the leadership of the Health and Hospitals Queens And I want to give special love and gratitude to Health and Hospitals at Elmhurst Hospital. I want to also recognize the leadership of the new CEO, Helen Artiega Lanaverde, for her steadfast leadership and really showing up and serving as a vital community partner during the pandemic, before the pandemic, and as we, heal as a community beyond the pandemic. So there's still a lot of work to happen, but I really want to highlight some of the partnerships that we were able to do alongside Elmhurst Hospital. Elmhurst Hospital has sponsored many of our community events. I represent the neighborhoods of Jackson Heights, East Elmhurst, Corona, and Woodside, Queens. They sponsored several of our paper shredding events, and those are very, very popular. We get about 400 folks, up to 400 folks at each of those events. They're a wonderful team that does community outreach, has given out information, resources to the community, PPE, hand sanitizer, and has just been on hand to answer questions as we know the vital need in our community. We've also worked together to encourage our constituents to get vaccinated, and we promoted the mobile vans that were in dire need, particularly during the Omicron surge when we saw lines wrapped around many of the facilities for testing. So we're just so thrilled for the partnership we have with Health and Hospitals, and again, particularly Elmhurst Hospital, that has been such a vital partner, not just for my district, District 34, but for all the neighboring districts that serve that are in which our constituents are being served by Elmhurst Hospital. So again, I want to thank you all and thank the leadership for their partnership and just for being not just a hospital, but really a community center. So thank you so much for having me. And again, thank you to the leadership and to the public that's here to voice their concerns and their ideas and to really have the board really listen. So thank you all for participating. Civic engagement is so critical, especially in our community. Thanks so much.
Thank you so much for sharing your comments. We appreciate it. Our next presenter will be Sylvina N. Brooks Powers, Council Member, New York City Council, 31st District. In a moment. Tell him to star 6 to unmute himself. Oh, please press star 6 to unmute yourself. Do you want to move on and then come back? We're going to move on and then come back. The next presenter will be Francisco Moya, Council Member, New York City Council, 21st District.
Thank you so much. You'll excuse me, but I had some dental work done today, but only Helen Artiaga can get me out of the dentist chair to come onto this Zoom. That's how much power and influence this woman has. It is just a real pleasure to see all of you. I hope you and all of your families are doing well and staying safe. We've had a real issues that have arisen from the last 2 years of COVID. Elmhurst was the epicenter of the pandemic. Our community, it really shed light on a lot of the inequities that we have all known of what has been going on in communities that surround Elmhurst Hospital. But I have a great love and affinity for that hospital because I proudly say I was born at Elmhurst Hospital, I worked at Elmhurst Hospital, and I represent Elmhurst Hospital. And to me, I have made many friends along the way and know that those first responders, from the staff to the doctors and the nurses, all the clinical staff, really truly rose to the occasion to really help our community in a time of great need. And as an elected official, it was also my obligation to be able to step in and when it was needed, brought in over 125,000 PPEs to the hospital in the very first stages, because we know that that's what was needed at the time. And then the resources in the past gave $5 million to help with the expansion of the emergency room. But we know that a lot more needs to be done. We have a limited amount of hospitals. We know the hospital closures throughout the borough of Queens. We only have 2 public hospitals in this borough that is a borough of over 2.8 million people. We know that quality healthcare is important, and access to quality healthcare is important, and that's where our investments should be made. Our investments should be in our hospitals, in making sure that people have preventative care, access to the specialists that they may need, especially in immigrant communities where we really need to start making the investments in translation in different languages, but we also need to share what is so critical is that the support network be there, so that we can continue to learn from what happened in the past so we never get put in that situation again. But like I always say, that you can judge a person's priority through the budget. And right now at the City Council, we're in the process of working on our budget that is due at the end of June, and working in hand with the mayor and my colleagues in the City Council to ensure that we are bringing the resources to Elmhurst Hospital. It's a priority for me. Helen has given me that list. It's a very long list that, it's like a scroll. When you open it up, it keeps rolling out because it's just nonstop of what it is. But we are committed. I am committed to ensuring that we get everything that we can, so that the people of our communities can really be proud not only of the service that they're receiving, but making sure that the quality healthcare is truly coming to our community. So I want to thank everybody for being here. I want to thank the public, and of course my colleagues in government who are working hand in hand to ensure that we have a better public hospital system, not just for our communities, but for all New Yorkers. So thank you very much, and I hope to see you all soon.
Thank you very
Thank
much
you.
for your comments and for promoting good dental hygiene and health. We appreciate that. We're going to try to return to our prior presenter, Sylvina N. Brooks Powers. And if you're available, please.
Hi.
Great. Nice to see you.
I was having technical difficulties and was feverishly trying to get it corrected. So thank you. It's always a pleasure to go after my esteemed colleague, Councilmember Moya. But good evening, everyone, and thank you. I'm Councilwoman Sylvina Brooks Powers, representing District 31 in the City Council, which includes parts of Southeast Queens and Eastern Rockaway. It's good to be here with Health and Hospitals to discuss the department's performance. Health and Hospital has been a valuable partner in the fight against COVID and the work to expand healthcare access in Queens. Communities of color, like the ones I represent, have faced serious healthcare inequities for decades. The pandemic has exacerbated these inequities, but they did not start with COVID and they will not end with COVID. We deserve healthcare that is accessible, affordable, and high quality. But we know that many people across the borough suffer from inequitable allocation of health resources. And in light of this reality, I would like to flag the following issues that my constituents are facing. First and foremost, I want to emphasize the need for a new trauma facility in Southeast Queens. And let me be clear, we need another hospital, or at a very minimum, an emergency department that provides trauma services, not a clinic. Following the closure of Peninsula Hospital a decade ago, Rockaway residents face dangerously long travel times to the nearest facility, which right now is Jamaica Hospital, which Jamaica Hospital, as we know, is pretty stressed and overburdened in terms of the care that they're able to provide. And when the difference between life and death comes down to a few minutes stuck in traffic, that's not acceptable. And it's about time we bring quality healthcare back to the Rockaway Peninsula in Southeast Queens. I look forward to engaging with Health and Hospital and other healthcare providers across the city to identify opportunities to increase the access. And I also like to highlight the continued need for consistent and expanded access to testing and vaccination sites. These sites fill a critical role in keeping our community safe and reducing the likelihood of COVID exposure. My constituents and I have appreciated Health and Hospitals' work thus far in prioritizing our district for these resources. And consistency is key here. So residents need to know that a test is readily available in their neighborhood when they need it. And I particularly like to acknowledge Health and Hospitals' recent commitment to keep testing resources at Sorrentino Recreational Center in Far Rockaway. The Parks Department is preparing to reopen the center as a recreational space, and I'm pleased that the Health and Hospital will replace testing services with a dedicated mobile van nearby. Communities across the city deserve the same commitment. Although the vast majority of New Yorkers are vaccinated, yet the numbers still remain low in communities like the one I represent. COVID is not over, and we should be continually working to ensure that testing and vaccinations are available to those who need them. This is about keeping all New Yorkers safe from this virus. Thank you so much for your time. I'm looking forward to hearing from the community around the services with Health and Hospitals, and wishing everyone a wonderful rest of their evening.
Thank you so much, and I'm glad you were able to overcome those technical difficulties. We're going to move on to our next presenter, Esther Rosario, Communications Director, Representative for State Senator Jessica Raymond. We're going to move along and return. Chanel Martinez, Community Affairs Coordinator, Representative for New York City Council Member Shakar Krishnan, 25th District.
Hi, everybody. Thank you. As recently just shared, my name is Chanel Martinez. I'm a Community Affairs Coordinator for Councilmember Krishnan's office, representing Jackson Heights and Elmhurst and Elmhurst Hospital. And we couldn't be more proud to have Elmhurst Hospital within our district. Prior to joining the office of Councilmember Krishnan, I was actually a patient navigator in the health and hospital system, including Elmhurst Hospital, which showed me firsthand how vital Elmhurst Hospital is and our public hospital system to our communities. We know that Elmhurst Hospital continues to provide quality and dignified care to our community and our district, and it was a lifeline before, during, and after the pandemic. We know that it was the heart of our healthcare system and continues to be. At the beginning of the year, we were so excited to celebrate with New York City Care the 100,000th enrollment into the New York City Care program, which continues to provide vital healthcare access to our community members without health insurance. We also we're so excited to see the expansion of the health and hospital systems at the COVID Center of Excellence here in District 25. We continue to partner with Elmhurst Hospital and are always so enthusiastic to have them as a phenomenal partner in all of our events. We hosted 2 events in April during Public Health Week, where we had a resource fair and a mental health forum, where Elmhurst Hospital came to both table and present at the mental health forum. We also had a Ramadan health series where we educated the community about stroke awareness. Most recently, we also had an iftar food box giveaway and a paper shredding event that brought out so many individuals to the community, and we were able to provide incredible education about diabetes prevention and chronic disease prevention. We will continue to be stark supporters of our public hospital system, especially Elmhurst Hospital, and they will continue to be a top priority for us. And we just wanted to give a big thank you to Helen Artiega and Natia Butler and the rest of the Elmhurst Hospital team, providers, and healthcare workers for doing all that they do. Thank you.
Thank you very much for your comments. Our next presenter is Carlos Cortez, our Community Advisory Board Chair for the Elmhurst CAB.
Hi, thank you for this opportunity to speak with you. Good evening, President and Chief Executive Officer Dr. Khan, directors of the Hospitals Board, elected officials, and other guests. I'm Carl Cortez, Chairperson of the Elmhurst Hospitals Community Advisory Board, the CAB. So on behalf of the Elmhurst CAB, I extend my sincerest thanks to the hospital staff at all levels, doctors, nurses, administration, and support staff.
And I'm panicking now because I don't know if they
The
call my name
volunteers,
yet.
many mentors for the life-saving work that they perform every single day, even prior to COVID-19. I want to especially take a moment to recognize Lorraine Bohm, for example, who worked at Elmhurst as a nurse and a nurse leader for over 30 years and is now a volunteer in the auxiliary. Words do not truly express the appreciation for your dedication and commitment. Similarly, our leadership team, Ms. Helen Artiaga Landaverde, our newly minted PhD and Chief Executive Officer, the first woman to head Elmhurst Hospital, Medical Director Dr. Jasmine Morshipur, Chief Nursing Officer Joanne Gull, Chief Operating Officer David Guzman, who are committed to the communities served by the hospital. I'm reading from prepared remarks, uh, but my remarks also come from my heart. Before I describe all of the fantastic work that is taking place at Elmhurst Hospital, I want to this point discuss a couple of items that need to be brought to your attention because they are system-wide issues. For example, medical staff shortages, so specifically sonogram techs, which results in patients needing to be sent to outside facilities. There are long wait periods to find available appointments. There's overcrowding at our clinics, and then at the appointment, long waits to see specialists. These are not necessarily the fault of the hospital because they are system-wide issues and problems, and perhaps even nationwide in the case of the medical staff shortages. Some may actually be the result of the hospital's unsuccess because the more and more people know how great a hospital services that Hermos provides, and they go there just like I do. There's a high demand for services, but not enough staff. And while there are many, many capital improvement projects underway, there's also a real need to upgrade, renovate, and expand the emergency department. Sometimes the ED is seriously overcrowded, which has an impact on other services, such as patients at clinics needing to wait for x-rays when the ED takes priority due to medical emergencies. The CAB has been informed by the hospital CEO, Helen, of the steps she is already taking to address these problems, but I must mention them so that they do not fall by the wayside. Now, for the great achievements during the past year at Elmhurst Hospital. Elmhurst has delivered over 2,000 babies, and I'm sure that there are many there that will follow in Mr. Moria's steps. Treated over 130,000 patients for its emergency departments, the adult, child, and psychiatry. It's received the Target Gold and Target Gold Plus awards from the AHA Treatment for Stroke and Blood Pressure Patients for the third year in a row. Almost administered COVID-19 vaccines to over 120,000 patients and attained a vaccination rate over 95%, ensuring that the neighborhoods around Elmhurst have one of the highest vaccination rates in New York City and in the nation. The hospital has also been nationally ranked by the U.S. News and World Report this past year as one of America's top hospitals for the treatment of patients in 6 categories: COPD, heart failure, heart attack, kidney failure, orthopedics, and pneumonia. So these accomplishments are fantastic. Now, in the financial area, the hospital also has done tremendous work. For the fiscal year ending March 2022, despite the judiciously overspending by 28.5 million, the hospital still has a budget surplus of 42.5 million due to receiving additional revenue of 71 million. This financial improvement places Elmhurst on track to meet its 5-year goal of achieving 100 million in annual operational savings and revenue growth. In light of all of the struggles of the healthcare industry, this is a tremendous achievement during this pandemic. These are all significant achievements given the enormous tasks facing the hospital, which provides care for a community that is often underserved and under-resourced. Additionally, the ongoing financial support from our federal, state, and especially our local elected officials is making much needed capital improvement projects at Elmhurst. I really look forward to attending groundbreakings and ribbon cuttings for a new labor and delivery room, additional operating room suites, and of course, a renovation and hopefully expansion of the emergency department. And of course, other exciting projects that are underway and will benefit the patients and their families. I know HHC will support the ongoing high-quality services that Elmhurst provides to our community. Thank you very much.
Thank you very much for your comments. Our next presenter is Rasha Kadir, representing Councilmember Natasha Williams, District 27. *69 if you're muted. *6, I'm sorry. Thank you, Clesia. Okay, and we're going to move on and come back. So the next presenter is Carolyn Brown, our Community Advisory Board Chair for the Queen's Cab.
Good evening, everyone. I am Carolyn Brown. Can you hear me?
Yes.
Okay. I'm grateful to have this opportunity to address key members of the New York City Health and Hospitals, local officials and their representatives, community leaders, and my fellow CAB members. We all share a concern for the future progress of New York City Health and Hospitals Queens and the entire public hospital system. It's been a very busy year for us, and I'd like to share some of the highlights that illustrate the enormous progress being made on behalf of our patient population. Just today, we learned that Queens Hospital has received a leapfrog hospital safety grade score of A in the organization's spring 2022 survey, the highest possible score. This safety grade uses up to 22 national performance measures from the Center for Medicare and Medicaid Services, the National Healthcare Safety Network, patient safety surveys, and other supplemental data sources. New York City Hospitals Queens was one of 2 health and hospitals facilities to receive the highest letter grade score of A. It takes a true team to earn an A, and all the members of Queens Hospital staff helped us to come to this time. It has been about, it's well over a year that we've been administering the COVID-19 vaccine to members of the public and to hospital staff. We have now administered well over 100,000 doses of first, second, and booster shots. This ongoing endeavor, which has involved many Queens employees working long hours in the hospital atrium, has demonstrated a collective courage and heroism among our staff. We cannot thank them enough for their dedication and their fortitude. Last fall, our hospital leadership team had an internal recognition ceremony of our intensive care unit staff for having had 0 central line associated bloodstream infections for 3 consecutive years. This achievement is particularly noteworthy in view of the reported increase in hospital-acquired infections happening elsewhere in the United States during the coronavirus pandemic. The entire ICU team was present, and each person received a certificate of appreciation. Most recently, Queens Hospital was a recipient of $1 million in funding from U.S. Senator Charles Schumer and U.S. Representative Grace Meng for the creation of a new outpatient dialysis center. The new center will address a significant medical need in our community, given the high number of patients with end-stage renal disease or kidney failure. It will also allow patients with chronic renal dialysis needs or those waiting for a kidney transplant access to dialysis treatments on the Queens Hospital campus. Queens Hospital also held a ribbon-cutting ceremony for its new orthopedic services total hip and knee replacement center, which now allows our patients to have these procedures at our facility. Equipped with a full team of medical providers, the center has the capacity and the expertise to take care of trauma-related orthopedic cases, including fractures and muscle repair. The hospital's Department of Pediatrics was a recipient of a grant of the Advocacy Network aimed at early and effective treatment of sickle cell disease a condition that disproportionately affects our community. An additional New York State grant we received will establish a home-delivered food and vegetable prescription program for low-income families with young children. Queens Hospital was one of 9 organizations across New York State that received grant awards totaling more than $1.5 million in support of policies and programs that connect New Yorkers to healthy, affordable food. Now, with respect to patient experience, we have proactively partnered with the Plaintree International Organization, are in the process of applying for certification in person-centered care. As part of this endeavor, all staff will be engaging in empathy training to improve communication and overall attitude. We continue to reinforce the eye care principles of integrity, compassion, accountability, respect, and excellence. Our managers are asked to provide real-time feedback to employees, both positive and negative, on an ongoing basis.
If I could ask you to please wrap up your comments, you have gone over. So, and remember, you can submit your written comments into the record.
Yes. Now, this is just a few of what we've done. And as a new CAB person, I will do all I can to bring this to fruition. And I thank you.
Thank you very much. Thank you. Our next presenter is Detective Jessica Nugent, who's a detective with the New York City Police Department, Community Affairs.
Yes, hi, how are you all? I'm sorry, I'm driving, so let me pull over. Hello, how are you? I would like to say thank you for inviting me. I'm the youth officer for Patrol Borough Queens North, well, detective for Patrol Borough Queens North, and I have to say, I want to say thank you to Elmhurst Hospital for being there for us all the time, helping us with programs. Girls Talk, educating our girls about different topics. Lately, we just partner up with the Show and Roll program, which is educating the community. And I'm very happy to help out, to be there with our 110 precinct community affairs officers and youth officers. And I have to say thank you, Elmhurst, for everything that you do. You're always there. Atia Butler, love you. You're the best. And that's all I have to say.
Thank you, Detective. And I'm sure I don't have to tell you, drive safely. Our next presenter is Anthony Feliciano, Director, Commission on the Public Health System. If you're there and having technical difficulties, *6. All right. Why don't we move on and then come back as necessary? The next presenter is Stephen Monroe, Joint Labor Chair, New York City Health and Hospitals. *6. Give it a try.
Hello?
Yes.
Good evening.
There you are.
Can you hear me?
Yes, we can, and we see you too.
Good evening to the leadership of Elton Hospital, Dr. Katz, to the leadership of Amherst Hospital, to the leadership of my beloved Queens Hospital Center, elected members, and members of the CAB. Good evening, all. My name is Stephen Monroe. I've been employed by the hospital for the past 14 years as an assistant coordinating manager in the Department of Psychiatry. I replaced Albert Willingham, who many of you might remember, as chair of the Labor Caucus when he retired in 2019. At the same time, I became Labor chair and co-joint chair of the Joint Labor Management Committee. As the Labor chair, my objective is to work together with hospital management to achieve common goals. I became an advocate in 2016 at the time when I became a staff steward and a representative of my union. My responsibility is to take into consideration the interests of both labor and management. Both labor and management, so that everyone has a seat at the table. From a labor standpoint, it is my job to make sure that our employees are treated fairly, working alongside human resource to broker peace among the staff. I must admit that this is a huge task at times. My task is to see that management uphold the interests of labor, while at the same time seeing to it that labor adhere to the policies and interests of management. More so than not, more often than not, the present is a highly challenging situation, but I believe my measured approach lends itself to being able to meet this challenge. In the height of the pandemic, while it was quite difficult for members of my committee to secure appointment, I started my own vaccine drive, which led to a collaboration between myself and Anthony Andrews, our past CAP president, working in conjunction with our ambulatory care head, Ms. Sarojini Kumar. This partnership resulted in thousands of patients visiting our hospital for the first time, where they come and get this vaccine. It was a huge success. I continue to be steadfast to the cause of labor with an aim to keep Queen's Hospital and make it a place where patients can come and receive the best health care in this part of Queens. In closing, I'd like to congratulate the team at Queen's Hospital for achieving a grade A in the Leapfrog spring program today. I wanted to say that I will continue to do my best. I would like to, over the months to come, I hope that I could able to see and meet some of you and where we could interact. But my interest is just to make Queens the best hospital in this part of Queens. Thank you.
Thank you very much for your comments. We're going to return to Rasha Kadir, representing Council Member Natasha Williams, District 27. Star 6 to unmute. I'm hoping for success this time.
Oh, can you hear me?
Yes, we can.
Hi,
Welcome.
I apologize. I was also having technical difficulties, but hello, my name is Rasha and I'm a constituent liaison here on behalf of the Office of Councilmember Natasha Williams. Councilmember Williams represents Council District 27 of Southeast Queens, and we're here to just listen and see how our office can partner with New York City Health and Hospitals. And we do thank New York City Health and Hospitals for all the support and resources they have provided so far for Southeast Queens. Thank you.
Thank you very much. Our next presenter is Raj Punjabi, member of the Elmhurst Community Advisory Board. Welcome. Star 6. Let's give it a moment.
Can you hear me now?
Yes, welcome.
Good evening, everyone. My name is Raj Punjabi, and I'm a member of New York Health Hospital Elmhurst Community Advisory Board. Thank you for this opportunity to speak today. I joined Elmhurst Hospital CAB in 2020, and I like to work with the community, all the communities around us. New York Health Hospital Elmhurst is a very important part of the Queens community, as it is the only level 1 trauma center in the neighborhood that provides vital life-saving services and much needed care to the predominantly poor and undeserved population. The staff at the hospital work tirelessly to take care of every patient, especially in the emergency department, which needs to be expanded so that the hospital can care for more people in the community. The world has seen what Elmhurst Hospital can do, and Elmhurst Hospital has proved itself during the pandemic time. I would like to talk to you this evening about some of the patient care and community outreach initiatives that the hospital is involved with. New York Health Hospital Elmhurst started its journey to be certified in excellence in person-centered care by Plaintree 1 year ago. part of this journey in person-centered care, several initiatives have been launched over this past year, including Person-Centered Steering Committee, Patient and Family Advisory Council, compromise of active patients and family members, hospital-wide experimental learning workshop called Communicating Empathy and Reconnecting to Purpose. MyChart mobile expansion, inpatients can now access their medical records online. Expansion of CO rounding practices, Ms. Helen Artiga will meet and greet more hospital staff in all work areas, giving them an opportunity to voice compliments, complaints, and improvements, with more on the way. ELMUS has also made a diligent effort to expand community outreach initiatives. For instance, ELMUS ambulatory care team and community outreach team do frequent health fairs and provide blood pressure screening for community-based organizations throughout the borough. This includes several organizations such as schools, community boards, and CBOs such as the ELMUS Community Recovery Coalition, ELMUS Community Partnership, Asian Americans for Equity, Jackson Heights Flower Festival, and the Colombian and Ecuadorian consulates. ELMUS providers also have participated in a number of virtual health education events with our local elected officials, schools, and community-based organizations to stay engaged. ELMUS has been creative in terms of community outreach and engagement. The hospital started a daily and grocery vaccination cup initiative, which provides important vaccination health education that can fit inside of a cup for portability and ease of access for hospital information and services. Our community outreach team has distributed these cups to many small businesses in Central and Western Queens. This program has been positively received. More than 18,000 cups have been distributed during the past 8 months. Further support small businesses, ELMUS is partnering with Queens Chamber of Commerce through their Small Business Heroes program to fund chamber membership. I'm happy to see the efforts that ELMUS has made to improve patient satisfaction and community engagement to ensure that the hospital is meeting current needs. I look forward to learning more about these efforts in the future and working closely with ELMUS leadership to provide community feedback. Thank you again for your time.
Thank you very much for your comments. Our next speaker is Lorraine Bohem, Elmhurst Auxiliary Board Chair. Star 6. Online? Do you want to try star 6? If not, we'll move on and try to come back to you again. Okay. Let's move on. The next presenter will be Brandy Stanbury, a member of the Queens Community Advisory Board. Okay. Next presenter will be Violet Huey, also a member of the Queens Community Advisory Board.
Evening, everyone. I'm Bonnie Huey, a member of the Community Advisory Board of New York City Health Hospital, Queens. I appreciate this opportunity to speak with you regarding recent developments and progress taking place at the Queens Cancer Center of Queens Hospital. Although the Cancer Center has been in existence since 2001, many people are not aware of this incredible borough resource and all the benefits it offers the community. There are services offered right here in this hospital that mitigate the need for members of our community to travel to Manhattan to receive high-quality cancer care. The Queens Cancer Center of Queens Hospital provides a wide range of services so essential to those who are dealing with the diagnosis of cancer. The Queens Cancer Center provides services in surgical oncology, medical oncology, breast oncology, gynecological oncology, and urologic oncology. The center also offers pain management, palliative care, genetic counseling, survivorship clinic, sickle cell services, and hematology. The center has a 14-chair infusion center and provides chemotherapy as well as infusion services such as hydration and iron. Since last October, it has reinvigorated its screening services after a temporary halt due to the pandemic. Queens Cancer Center is now offering mammography screening in October, and just last Friday, conducted its Mother's Day mammogram program with the goal of conducting mammogram screening twice a year for both Mother's Day and Breast Cancer Awareness Month in October. Under the expert direction of Dr. Margaret Many, who has been affiliated with the Queens Cancer Center from its inception, the center is an intimate, cutting-edge hub of activity that is operating on all cylinders, a place where clinicians and patients form lasting bonds so essential to their recovery. The Cancer Center's presentation of healthy lifestyle events has been well received by its patients. Led by a staff nutritionist, these are monthly activities emphasizing the importance of nutrition that demonstrate how to cook healthy meals, enabling cancer survivors to take the necessary steps to live their best lives. Looking towards the future, the Queens Cancer Center is planning to introduce a colon cancer screening event. This would involve a take-home test known as a fecal occult blood test that the patient does in the convenience of their home and then brings back to the cancer center for further analysis. Regarding colonoscopies, Queens Hospital Colonoscopy Center has recently introduced availability of expanding hours on Saturdays for routine colonoscopy screening. As of February 5th, the Colonoscopy Center currently performs 10 colonoscopy exams each Saturday between the hours of 8 a.m. and 4 p.m. This is important for patients who work full-time because the earlier colon cancer is detected, the greater the chance for eradication. I thank you for the opportunity to address you this evening. Thank you.
Thank you for your comments. The next presenter is Malika Carteron, member of the Queens Advisory Board.
Good evening. As stated, my name is Malika Carteron, and I am a member of the Queens Hospital, New York City Health and Hospitals Queens Community Advisory Board. This evening, I would like to highlight 2 milestones that have happened recently at New York City Health and Hospitals Queens. The announcement that Queens has secured $1 million in federal funding for the creation of a new outpatient dialysis center and a Donate Life Month celebration for the purpose of promoting organ donation. In March, it was announced that New York City Health and Hospitals Queens has secured $1 million from U.S. Senator Charles Schumer and U.S. Representative Grace Meng through the Fiscal Year 2022 Consolidated Appropriation Act for the establishment of a new outpatient dialysis center. This funding is crucial for the development of the dialysis center. Once established, the new center answers a significant medical need in the community given the high number of patients with end-stage renal disease or kidney failure. It will also allow patients with chronic renal dialysis needs or those waiting for a kidney transplant access to dialysis treatment on Queens Hospital's campus. This will allow New York City Health and Hospitals Queens to further close the gap in delivering services and addressing disparities in healthcare access and delivery. The $1 million funding will help renovate the current space and update the treatment area with modern equipment, improving lives of residents and reducing the health care disparities among those living in Queens. The overall goal is to provide high quality, timely, and patient-centered care to a chronic care patient population in a single site setting. Lastly, in the event of an unlikely adverse reaction, having the hospital as a primary site of care affords Queens Hospital patients the benefits of having emergency response services always close at hand. In April, Queens Hospital held a Donate Life Month celebration in partnership with an organization known as Live On New York to raise awareness of the importance of organ, eye, and tissue donation. Live On New York is a federally designated organ procurement organization for the greater New York City area. It was the first time the hospital conducted such an event, and it was intended to honor both organ recipients as well as those who have worked to grant a second chance of life for those in need through the gift of organ donation. This event was held in conjunction with April being National Donate Life Month. The National Donate Month initiative is asking people who may not have considered it before to become part of this life-sustaining community of registering it as an organ, eye, and tissue donor to become educated about living donations as well as to champion a Donate Life cause. Here at Queens, the hospital is already making great progress in the area of organ donation and the benefits provided to the families. Over the course of the last 3 years, Queens Hospital has had 8 organ donors and 21 lives being saved and 15 tissue donors. I'm going to repeat that. Queens Hospital has had 8 organ donors and 21 lives saved by the organ donations and also 15 tissue donors. If we can maintain this momentum, we can ensure that many more lives will be enhanced, even saved, for members of our community. I appreciate the opportunity to address you this evening. Be well, be safe, take care.
Thank you very much for your comments. The next presenter is Merlene Smith Sotillo, also a member of the Queens Advisory Board. Welcome.
Good afternoon, everybody. Can you hear me?
Yes.
My name is Merlene Smith Sotillo, and I'm a member of the Community Advisory Board at Queens at Hospital Queens, and I'm also the president of the Sickle Cell Awareness Foundation Corp International. I am here tonight to talk to you about sickle cell disease, its prevalence in the Southeast Queen community served by Queens Hospital, and the advancement being made to address this disease. The fact is that no other disease better exemplifies the effect of racism in healthcare than sickle cell disease. We all have an intuitive understanding of what that means, but the actual data is heartbreaking. While the mortality rate for children is decreasing, the overall mortality rate for sickle cell disease is increasing, with young adults having the highest rate. These healthcare inadequacies are simply unjust and reflect the low priority given to sickle cell disease as compared to other chronic diseases because of whom it affects. The Sickle Cell Awareness Foundation Corp International, one of the premier sickle cell organizations in New York City, and which I represent, is thrilled to continue our partnership with Queens Hospital to address these inequities. The partnership we share with Queens Hospital includes our fervent support of Queens Hospital comprehensive sickle cell program that provide the best of care for individuals and their families affected by sickle cell disease across the lifespan. Together, we are dedicated to eliminating disparities in care for this debilitating illness. Going forward, our plans are to partner with Queens Hospital on the grant from the Federal Health and Human Services Office of Minority Health to increase the use of hydroxyurea in children from 9 months to 21 years of age with certain genetic condition, specific to sickle cell. The use of hydroxyurea dramatically improves outcomes and quality of life, yet it is underutilized in children. To change this, the grant support a shared mental model of the importance of hydroxyurea between the emergency department provides pediatrician, pediatric hematologists, and sickle cell community-based organizations. We will support individuals and families' decision about the disease-modifying drug through education and support groups. Queen's Hospital offers individuals with sickle cell the opportunity to participate in clinical research. As the hospital is part of the American Society of Hematology Sickle Cell Clinic Trial Network. This is an exciting program designed to increase the number of drugs available to improve the lives of people living with sickle cell. We look forward to placing a member of our organization of the American Society of Hematology Sickle Cell Disease Clinical Trial Advisory Board. In addition, Queen's Hospital is working with both the American Society of Hematology Sickle Cell Disease Learning Collaborative and HRSA's Sickle Cell Treatment Demonstration Programs Quality Improvement Initiative. We are eager to bring working with them in eliminating disparities of care and decreasing the stigma individuals with sickle cell disease face when presented to the ER in pain. Lastly, Queen's Hospital will be providing us with grant funding to help support our advocacy and community outreach effort and education regarding sickle cell disease, modifying drug hydroxyurea, and other initiatives directed towards wellness. As many of you may not be aware that the sickle cell bill has been signed into law in December of last year by Governor Kathy Hochul, where the Commissioner of Health would write the language for sickle cell disease and sickle cell trait for all hospitals. I appreciate having had this opportunity to address this year's annual public forum. Thank you so very much, and I appreciate your time.
Thank you very much. We're going to go back to Lorraine Bohm, Elmhurst Auxiliary Board Chair. Let's see if we have better luck. Star 6.
Can everyone hear me?
Yes, welcome.
Yes. Oh, wonderful, wonderful. So I had some technical difficulties as well, but I'd like to say, first of all, good evening to everyone. I am honored to speak for Elmhurst Auxiliary, and I'm a new member. And I'd like to thank all of the wonderful speakers so far I've heard today to acknowledge Elmhurst in such wonderful ways. We've done a tremendous job, and I'm very proud and honored to be a staff member. I'm a nurse educator, a retired nurse educator at Elmhurst, and I was there during the pandemic, and I was very touched by what everyone said about Elmhurst and acknowledge their set of challenges that they face on a daily basis, especially through the pandemic. So thank you very much for all of that. I'd just like to acknowledge also the work of the auxiliary in providing for community needs during the pandemic as well as after the pandemic, as we're struggling through this now. We participate in providing health fairs for pediatric patients, families, for Halloween and back to school and other health-related activities. We've also participate in the Walkway of Honor. We have a pathway leading from the garage to the hospital of bricks where community members, hospital staff, families can purchase a brick and acknowledge living members of the community or the staff or people who have passed away in honor of them. And that money is then used for hospital needs to improve patient care and quality of life for patients and staff as well. We've bought several pieces of equipment and participated in expansion of departments, so we're very proud of that. We also host a gala at Queens Museum, and we do that every year, and also participate in the raffling of baskets and other donations to raise money for the same purposes. So I'm looking forward to continued challenges at Elmhurst, and we're all very active. There's 5 of us on the auxiliary, and we are very active in the life of the hospital and willing to participate in any way we can help Elmhurst stay afloat and be successful.
Thank you. Thank you very much. Our next presenter is Martin Dunn, President, Developer of the T Building, Dunn Development Corp.
Hi, good evening. Thank you for having me. So as mentioned, I'm the founder of Dunn Development Corp, and we're a developer of affordable and supportive housing with a more than 20-year track record of developing mixed income and mixed use buildings. A number of years ago, we were selected to be the developer for the T Building, which is the historic tuberculosis hospital on the Queens Hospital Center campus on Parsons Boulevard between 82nd Drive and Gotham's Boulevard. Almost 3 years ago, we entered into a long-term ground lease with Health and Hospitals and began the process of rehabilitating this historic building. The building's 10 stories tall and approximately 238,000 square feet, and we've converted it now into 200 residential apartments, plus approximately 20,000 square feet of non-residential community facility space. As part of the development of the project, we undertook a historic restoration of the building. The building was placed on the National Register, and under the oversight of the State Historic Preservation Office and the National Park Service, we completed the renovation of the building to historical standards. And that restoration included both all the exterior elements of the building and many components of the interior as well. And it's really been a model project for adapting an obsolete building to a new use. And we're proud to say that we just won a very prestigious Lucy B. Moses Award from the New York Landmarks Conservancy. The apartments range from studios, 1 bedrooms, 2 bedrooms, and 3 bedrooms, and many of them have private balconies that were part of the historic building, and all of them have high ceilings and large windows. There's also lots of amenity spaces from the original building. There's an auditorium and a community room. There's a historic computer library that we've turned into a community room. There's an exercise room. There's children's play areas and 2 rooftop terraces. Of the 200 units, 75 of those are supportive housing units, which means housing plus services that are targeted to single adults who are high-cost Medicaid users, who are homeless or poorly housed, and who utilize the Queens Health Network inpatient or outpatient facilities. So part of this building being done on the Health and Hospitals campus was to serve housing needs of Health and Hospitals consumers. So as part of that, there will be on-site support services in the building, a whole range of services right in the building to serve those supportive housing residents. And that'll be provided by CAMBA, which has a long and successful track record of doing this work and with whom we've had a long relationship. We work in 14 buildings together. And those support services will also be available to all of the other residents in the building. The remainder of those units, the 200 units, serve households earning a wide range of incomes, generally ranging from about $32,000 to over $100,000, although people earning less than $32,000 who have access to a rental subsidy are occupying units as well. So it's a very wide range of incomes, a very diverse group of people moving into the building. The units, the non-supportive units, were subject to a lottery that the City of New York manages, and we received more than 37,000 applications for the units. There was a preference for local residents, so 50% of the units were for residents. There's a preference for residents of the local community board, and that entire preference has been met. And there was also a preference for 5% of the units for municipal employees, which included health and hospital employees. And again, both preferences have been fully met. We're excited to say that residents began moving in 2 weeks ago, and we already have 56 households that have signed leases. So in a few more months, we'll be fully leased up. I mentioned that there was 20,000 square feet of non-residential community facility space, so I wanted to mention that a little bit. 12,000 square feet of that was leased back to health and hospitals for office space for any non-direct medical care uses. And for the other 8,000 square feet, we're excited to announce that Common Point Queens is going to be opening a youth opportunity center in the space. And I won't say much about that because I think the next speaker is Craig from Common Point Queens, who will tell you a little bit more about what they have planned for the space. And their space is in what was the historic kitchen with very tall ceilings and skylights. It's a really special space that's been restored. The last thing I'll mention is that there is a community advisory board that was formed. The community advisory board has been meeting throughout construction and will continue meeting during the operation of the project to address any concerns in the community. We have, I think, part of the reason we were picked as the developer for this project is we have a reputation for operating very high quality buildings, being a good neighbor, and being a positive addition to all the communities we work.
Thank you
So I'll
much.
stop there.
Thank you.
Thank you for the opportunity.
Thank you very much. And as you indicated, the next presenter is Greg Lastries, the Vice President of Operations, Common Point Queens, the community center tenant for the T building.
Can you hear me? How are you?
Hi.
So Common Point Queens is a community-based organization that serves roughly 60,000 residents in Queens. We have 4 flagship sites, one in Forest Hills, Bayside, Little Neck, and Elmhurst. We do everything from infant care, UPK, after-school programs, high school programs. We have an Article 31 mental health clinic, and we recently just opened our first adolescent mental health clinic about 4 weeks ago. Donovan Richards cut the ribbon with us, which is super exciting. Pool clubs, summer camps. We have test and trace contracts with the city, DIF to older adult programming, and we run 4 different food pantries. One of the most exciting things is in the height of the pandemic, we were serving roughly 10,000 people a week with home delivered meals for those community members that needed them. Dunn Development reached out to us about this community space, and where it's located at the T building is perfect. And we are the biggest SYEP provider in Queens, serving 6,000 youth through the Summer Youth Employment Program that the city has. And we surveyed them and what they needed. And I think all of us on this call can agree, it was alarming, the depression, the lack of socialization. So we said, hey, what can we do here that would be really cool? And we thought about a community youth center, so a youth opportunity hub. We have a hub in East Elmhurst that's workforce development. We have a training kitchen there, and we do allied health training. We said, hey, let's get the youth involved in this. So we're going to do allied health training. We have a room just for that, a fitness space, an art space, digital art, regular art, a classroom for tutoring, technology training. We are going to offer food pantry services there. Combined with the T building, people that need those services, there'll be a digital food pantry that they can log in and we'll get them food if they need it. We're going to offer mental health counseling for our teens. We have an Article 31 mental health clinic, like I said earlier. We're going to have some of those clinicians come over and give mental health services. And the cool part about it, as Martin said, it was a kitchen when it was the tuberculosis building. We're going to keep that kitchen, make it a little bit smaller, and offer training to teach the youth how to cook and how to prepare in a kitchen. And then during the day, for the people in the community and anybody that wants to come, hopefully have some food for them. We're going to offer some older adult programming during the day so they can use the facility. We are super excited about it. We hope to be cutting a ribbon somewhere in October, November, and really would love the community to come out. If anybody has any ideas or want to partner on making this space even better, Common Point Queens is here and really looking to make this an awesome space. Super shout out to the city council members. Everyone's involved with this in Queens, I think, and knows about it. State Assembly, Queensborough President. We've reached out to almost everybody, and everybody is super supportive of Common Point Queens and the things we do, especially in this new space we're about to build out.
Thank you and good luck. Our next presenter is Christopher Galarza from the Community Health Educator, Queens Public Library.
Thank you for having me, and thank you to Elmhurst Hospital, who has been an incredible partner to the Queens Public Library community, providing education and programs for our patrons throughout the entirety of the borough of Queens. One important partnership that Elmhurst Hospital and Queens Public Library has is our joint initiative of QPL Baby. In this joint initiative, Elmhurst Hospital and the early learning and community health teams at the Queens Public Library are creating targeted programming for children aged 0 to 5 and their guardians to promote early literacy and health information and awareness surrounding the importance of prenatal health care. Prenatal care has been identified as an area of concern by the community health team at the Queens Public Library for the neighborhoods of Long Island City, Astoria, Jackson Heights, Elmhurst, Corona, Ridgewood, Maspeth, Flushing, Whitestone, Kew Gardens, Woodhaven, South Ozone Park, Howard Beach, Jamaica, Hollis, Queens Village, the Rockaways, and Broad Channel. Lack of prenatal care and information affects all of us. According to a Centers for Disease Control report, the maternal mortality rate in 2020 here in the United States was 23.8 deaths per 100,000 live births, one of the highest in high-income countries. This rate is nearly doubled at 55.3 deaths per 100,000 births for non-Hispanic Black women, and this number is only rising. This underlies the importance of providing access to prenatal health information in our upcoming learning series that will run for 24 weeks, where Elmhurst Hospital providers will discuss with the library's community health educator topics concerning the lifespan of early childhood, from planning a pregnancy to taking care of yourself and your child until the age of 3. In addition, new mothers are provided diaper bags when they are inpatient at Elmhurst Hospital's Labor and Delivery Unit, along with Queens Public Library bookmarks and resources to promote early literacy, including an application for a baby card that new mothers and parents can bring to their local library to sign out books to read to their children, to make literacy a family endeavor that will improve outcomes for children, especially those who come from low English literate households, as we encourage parents to read to their children in their native language by providing books in a multitude of languages reflective of the diverse Queens community. Elmhurst Hospital is instrumental in improving health and learning equity to the Queens community, and Queens Public Library looks forward to continuing and expanding our partnership within this context. Thank you.
Thank you. The next presenter is Katha Catho, Queens World Film Festival.
Hello, everybody. It's Katha Cato from the Queens World Film Festival. Thank you so much for the invitation to share my experiences with Elmhurst Hospital Center. For over 30 years, we have lived about 8 blocks away, and we must have grown accustomed to seeing them because we never really noticed how many of our community members and our neighbors are in the health profession and worked at the hospital until March 2020. And throughout the worst of times, we saw them coming or going. We saw all of the people wearing scrubs. We would reach out to them to thank them, and they accepted our thanks graciously and often silently as they continued to shield us from the pandemic. It was incredibly awe-inspiring. As a 9/11 survivor, I'm served by the World Trade Center Health Program at Elmhurst Hospital Center. I know my way around emergency rooms, operating rooms, and all of the other different rooms one uses before, during, and after emergencies, surgeries, and check-ins. I know firsthand what it's like to have a complete stranger instantly become your lifeline. I also know that the staff of Elmhurst Hospital Center provided that for thousands and thousands and thousands of our community members as they held phones to their ears, as they held their hands, as they held space for those suffering in isolation. When it was time for our 2021 festival, we didn't have to think very long about who our Spirit of Queens honorees would be. We chose the entire staff at Elmhurst Hospital Center, and we asked the community to purchase deeply discounted festival passes for everyone there. We called them hero tickets, and the community stepped up, as did BLK Water and Film Festival Flicks, and we made sure that everyone at Elmhurst Hospital was covered with a complete pass to the virtual festival, and we were able to donate back $8,000 to the hospital staff from the ticket sales. After the festival, we've continued our relationship with the help of the incredible Atia Butler, and together we have been able to provide festival films free to the staff throughout the hospital through the hospital's IT department. And I've said it many, many times, and I want to repeat myself. How did we get here? Well, we piddled in the pool. We broke all of our toys, and we were very mean to our brothers. And so all of our systems have been rattled, and many of them broken, and justifiably so. But the one system that could never be broken was Elmhurst Hospital Center. Be well, everybody. Drink water. It helps with almost everything.
Thank you very much for your comments. Our next presenter, is Raida Hussein, Community and Government Affairs Liaison for Queens. Star 6.
Hi, thank you.
Hi.
Hello, can you hear me? Yeah. Hi, so thank you for having me here tonight. I'm the Queens Community and Government Affairs Liaison for Live on New York. I just joined 5 months ago, but I want to say that it's been a real pleasure working with Queens Hospital and Elmhurst Hospital, especially for Donate Life Month. We've had very successful celebrations where we highlighted the stories of the recipients of life-saving organ donations, as well as of the family members of the donors who have selflessly given the gift of life. Again, I just want to thank you for all of your great effort and what you do for the community. And I want to let you know that I am available for general education, tabling, anything that we can do to get out into the community and to highlight, state the importance of organ, eye, and tissue donation. My colleague, Jelena Young, Senior Hospital Services Specialist at Live on New York, is with me today, and she will be describing with more data and more details how Live on New York works with Queens and Elmhurst hospitals to facilitate organ, eye, and tissue donation. Thank you.
Thank you. Our next presenter is Leslie Ramos, 82nd Street Partnership.
Good evening, everyone, especially the Health and Hospital Board. I'm Leslie Ramos. I represent the 82nd Street Partnership. We are a business improvement district located just half a block from the hospital. And we have been partners with the hospital for many years, pre-pandemic. I had to say I've been delighted to work with the hospital because they have always found innovative ways to reach the community and to be able to serve the community in a way that is proactive. Pre-pandemic, we partner in things such as cooking classes in the park, something that we hope to continue and resume pretty soon. We collaborated in a program called Get Fit, where the hospital dietitians looked through the menus of our local restaurants and helped them pick items that were healthier, that allowed the community with dietary restrictions continue to eat their food from the native countries, but still adhering to their doctor's recommendations. And this is just a few samples of the wonderful things that we have done together. But nothing compares how the hospital went above and beyond to reach to a small businesses and their staff, during the pandemic and throughout the entire process. We work in a community that has a lot of concerns about obtaining services from anyone, including hospitals. The concerns can be that they have no access to health insurance. Helmut Hospital stepped out of their facilities and went door by door into our business district, letting the businesses their workers know about the services that they were offering. To talk to them about the vaccine, because there was a lot of concerns. And, they also talked to them about that the services were free and how they can qualify for health insurance. It is a type of service that it has in mind the community and the obstacles that they have to access services that makes, I think, Elmhurst Hospital and their staff special. I want to say, many thanks to their CEO, Elena, and as well as her team, especially Atia Butler and Rochelle Ramos, because they're always sort of thinking, what else can we do, right? They look at us as partners because we work in a community that's hard to reach, where information sometimes is abundance and is not clear, and there's a lot of speculations. And their ability to say, how can we serve and reach every single person, not only relied on what the city puts out there, but for themselves to go and knock doors, I think is completely admirable. I think that, and they did this while they are probably burnout and were really, really busy. They did not ignore the community, and they know their community really well. They knew that just by being in their offices was not going to be enough. So I'm a big fan, and I hope that the city continue to support the hospital and continues to support those divisions that are focused in community outreach, because that is where relationships are built. And I think that no one better than the Elmhurst Hospital knows how to carry out that mission. So I want to say thank you for the entire team, and I hope that we all see you when Elmhurst Hospital does their cooking classes again in Dorringham Triangle. Thank you very much for letting me speak tonight.
Thank you very much. Our next presenter is Linda Alexander, Chief Program Officer, Spence Chapin Services to Families and Children.
Hi, good evening, everyone. Thank you so much for having this opportunity. My name is Linda Alexander, and I'm the Chief Program Officer at Spence Chapin Services. We are a 100-year-old organization that provide free options counseling and resources to women and families experiencing an unintended pregnancy and who are unsure if and how they can parent. We are here to thank New York Health and Hospitals Queens for providing services for our clients and for referring clients to us who are in need of our services during a very critical time in their life. We look forward to a continued partnership with New York Health and Hospitals, which will enable us to continue to provide these services and have an excellent resource for our families around healthcare. My colleague, Monica Baker, is here who will speak, and I yield the rest of my time to her.
Good evening, everyone. I just wanted to take a moment to highlight the incredible work for the social workers at both New York Health and Hospitals Queens and at Elmhurst. We have had some tremendous collaboration with the social workers at both of those hospitals who have taken the time to connect with us and recognize in their patients that they were in a really tough position and weren't able to make a parenting plan for their baby. These social workers connected with Spence Chapin, and we were able to work with the patients to make a safe plan for their children. I'm thinking of one case in particular of a young woman who didn't even realize that she was pregnant. She was in a really difficult position and was not prepared to be bringing her infant home. She didn't have a safe home to go to, and in fact was experiencing homelessness. And this was during a time in the pandemic that I'm sure that the hospital staff was incredibly kind of overwhelmed with what was going on health-wise with the community. And this was a social worker who contacted our agency, and we were able to work with this woman so that she could make a safe plan for her child, and chose to make an adoption plan. And this was a situation that the child would have otherwise ended up in the foster care system. I'm thinking of another case with a child who was medically fragile, who the biological parent was considering long-term institutional care for the child, but that social worker thought of Spence Chapin and referred her to us. So we just can't thank you enough for the important role that you have made in the lives of these children who are now in permanent families and having open adoptions with the birth families. So thank you for your partnership, and thank you all for your time this evening.
Thank you very much. Our next speaker is Yelena Young, Senior Hospital Services Specialist, Live on New York.
Good evening, everyone. Thank you for having my organization here. Thank you, Atia Butler and Cleon Edward, for inviting me. I am the primary liaison for Queens Hospital and Elmhurst Hospital on behalf of the Organ Procurement Organization, Live on New York. We are a federally designated organ procurement organization that facilitates the process of organ, eye, and tissue donation within the hospitals. I wanted to highlight that the NYC HHC system led our service area with number of organ donors and lives saved in the year of 2021. We have families in our hospitals that are losing their loved one, and during the most difficult time in their life are saying yes to organ donation, to saving lives they may never meet. And sometimes they do meet those recipients. In addition to facilitating that process within the hospital and setting the stage, I want to thank the CEOs at both hospitals, Mr. Neil Moore at Queens, the CNO at Queens, Dr. Monshapur, the CMO at Queens, and also Leah Cervantes, who is the Nursing Critical Care Director. I've been working with them for the last 5 years to set the stage to ensure that from a regulatory standpoint, the hospital is meeting those guidelines, referring those patients to our organization so we can determine suitability and then support those families during that very difficult conversation. In addition to that, at Queens, we did have our first flag raising, as it was mentioned before. Thank you. And it was a momentous, historic moment because that was the first time that we raised that flag to honor all those organ, eye, and tissue donors and those families that said yes during the most difficult time in Queens, in our community of Queens. Now, moving on to Elmhurst, I want to highlight and thank the CEO, Helen, who has been a wonderful leader, Miss Gall, the CNO, who has been very supportive to ensuring that we set that stage at the hospital and educate the staff to the process. Despite COVID, we still had organ donation happening in our hospitals and families saying yes during the most difficult time. And we also had our first historic moment at Elmhurst where we raised the flag for the first time, where Miss Helen Artiega Landaverde spoke in collaboration with my CEO. And we were able to honor all the organ donors, the lives saved, and we made an impact to speak to the people waiting within our communities for life-saving transplants. And in addition to that, we had our first honor walk at Elmhurst this evening that happened just a few minutes ago. And I worked with Miss Gall, the CNO, to facilitate that for that family that was saying goodbye to their loved one. So again, this is an opportunity to bring light to the fact that we do have families saying yes in our community to organ donation, to encourage you guys within your organizations to speak about organ donation and make that decision. And like my colleague Rida said earlier, please invite her to your community events in the summer so we can be able to increase awareness on organ, eye, and tissue donation. Thank you again.
Thank you. Our next presenter is Anna Krill, President and Founder, Sharing and Caring. Star 6 to unmute. Yes.
Can you hear me? Oh, thank you. Good evening. My name is Anna Krill. I am a two-time breast cancer survivor and founder and president of Astoria, Queens, Sharing and Caring. This evening, I'm going to focus my remarks on the Queens Cancer Center, one of the crown jewels of Queens County and the only comprehensive cancer treatment center in the entire HHC network. I am the product of HHC system, having been born in Bellevue Hospital. My birth at Bellevue, as well as my initial cancer diagnosis 29 years ago, were indications of my future involvement in healthcare and the public health system. I proudly served as an advisory board member at Elmhurst Hospital Center, where I co-chaired the first ever Women's Health Committee and was privileged to be appointed to HHC as its Queens representative to the board of directors. While at Elmhurst and at HHC, I brought the perspective of a consumer cancer survivor, and I continue to be a voice and advocate for those who are very new to our healthcare system. Sharing and Caring was created to address the disparities in cancer care and treatment which existed in Queens County. It was our strong belief then and now that Queens residents should not have to leave the borough to receive state-of-the-art cancer treatment, care, and support. That's why we have been so proud to work and partner with the Queens Cancer Center. This beautiful facility is here today due to the vision, leadership, and tenacity of our late borough president, Claire Schulman. The center has been led since its inception by Dr. Margaret Kemeny, a leader in her field who has been recognized nationally and internationally. Under her leadership and due to her prominence in her field, the Queens Cancer Center is able to provide the most advanced cancer treatments, including clinical trials to the residents of Queens. As I mentioned, I am a two-time breast cancer survivor. I received my second diagnosis during COVID-19 pandemic. I entrusted my care, my life to Dr. Margaret Kemeny and the staff at the Queens Cancer Center. I, just like all the patients there, received the highest level of care given with compassion and empathy by every person working at this remarkable cancer center. I am happy to share that I celebrated my first anniversary, completing my treatments in February of 2022, and I have never felt better. The onset of the pandemic 2 years ago changed our world and that of the city's most vulnerable population, including cancer survivors. Now, more than ever before, it's critical that Queens residents should not have to travel out of the borough or travel to other ends of this borough to receive top-notch treatment and care that residents of Manhattan take for granted. All of us at Sharing and Caring stand ready to work with the Queens Cancer Center to ensure that our Queens residents have access to state-of-the-art screening and treatment. On behalf of the community of cancer survivors that I represent, I want to thank Dr. Kemeny and her entire staff of dedicated physicians, nurses, and staff members for the care that they render to our community. And I ask, please, that HHC support whatever resources they require to continue this excellence of care. Thank you as a cancer survivor, and again, on behalf of all cancer survivors that I represent.
Thank you and stay well. Our next presenter is Liz Carollo, Assistant Director, Food Access and Agriculture Initiatives, GROW New York City, or GROW NYC.
Hi there, everyone. Thanks so much for having me, and it's been really wonderful to listen to hear about all these great community health initiatives. We come in from the food side. As many of you know, GROW NYC operates a seasonal farmers market outside of Elmhurst Hospital, and we have been out there for 12 years doing so. We love that site and very happy to be there. And we will be reopening on June 14th. So mark your calendars. We always do a fun ribbon cutting and typically have some music and activity going on that day for opening day. So June 14th, and then we'll be there every Tuesday through November. Like I said before, we've been there 12 years. For the past 2 years, we were able to operate, provide a safe place for the community. Elmhurst is one of close to 80 food access sites that the nonprofit GROW NYC operates throughout the 5 boroughs. So we were able to keep our sites open through the pandemic and continuing on, and provide a nice, safe outdoor space for customers to purchase fresh food that's grown from within the region. A couple of additional shout outs specifically to the hospital. Last year, Elmhurst Hospital bought $10,000 in green market bucks, which are $2 coupons that can be spent on fruits and vegetables throughout the market, and distributed those to community members. So that's a big boost for our producers that are selling, and then helps get fruits and vegetables into the neighborhood. We also hosted the WIC Center, from the hospital, who came out and did outreach to parents and gave tours and explained how to use the Farmers Market Nutrition Program checks. So that was a great initiative throughout the year. And of course, we had guests out to promote breastfeeding for World Breastfeeding Week also. So we love being outside the hospital because of all these additional initiatives that we can add in to our market day. We did close to $50,000 in SNAP sales last year. And of course, anybody shopping with SNAP at the farmers market gets an additional $2 for every $2 spent, up to $10 per day. So you have that additional buying power if you're shopping with SNAP. That's pretty much it. I hope to see you all out there starting June 14th and through the summer. And I know our producers are excited to be back, and we can't wait to be there. And one last shout out to Atia. I've heard her name a few times tonight. Everybody loves Atia, and especially us. We are eternally grateful for the support she provides to the market. So thank you, and that's it for us.
Thank you. The next presenter is Amir Saul Mansour, Chief Operating Officer, Vital Check. Star 6.
Hi, everyone. How is everybody? This has been a great call. Thanks for having me on. Thank you, Cleon Edwards, for inviting me to join this public forum and speak at this public forum. Just to introduce myself, I'm the CEO of Vital Check. What we do is very simple, but a really innovative form of outreach, essentially. What we do, we partner with hospital systems like HHC. Obviously, Queen's Hospital we hope will step up initially, like Catholic Health Services, like NYU, Summit, Westmed, One Brooklyn. We partner with these systems to bring doctors from the system on site to corporations to really bring preventive care to these companies, to employer groups, employees. Obviously, we all know that there's a whole myriad of wonderful outreach initiatives that are being offered by HHC, and they're all incredible. But what might be slightly neglected is people working at work sites who really don't have time to really participate in any of these initiatives, or we don't have time to get the basic care. So we send doctors to places like Fordham University, Vaughan College, WIN, Safe Horizons, the Wildlife Conservation Society, obviously also for-profit firms like BlackRock, like SocGen, like Nomura. We get doctors on site to these corporations, and this is actually what it looks like. I'll share my screen very briefly. We pop up we work to operate these clinics. We bring in the HHC doctor. We pop a clinic in a conference room. So this is a clinic at Revlon. You see, makeup is not mandatory. We just bring a doctor on site to the conference room and provide free checkups. They're 100% covered by insurance, and we hope that people get their care finally. And we find all kinds of issues that people weren't aware they had. And obviously, at that point, we have these employees with very good commercial plans, union plans, other kinds of commercial plans, and we are getting them into care with HSC and Queen's Hospital. So we really hope in this way to kind of balance the patient population, a little bit more there with commercial insurance, and try to help that way. So this thing I'm glad to present to you. Thank you for listening. These are some of the companies we work with again. And essentially, the way it works is doctor in the conference room does physicals covered by insurance. Any referrals go to HSC of these employees. And we send the supplies in a magic suitcase. This is the magic suitcase. We send supplies in a suitcase to the room. The doctor pops up, does this amazing work, blood work, EKGs, etc., with a nurse. And we get people their preventive care and have all these amazing findings. And it is clearly quite life-saving. So thank you for listening. I really appreciate it. And thanks for having me at the end of the call. I really appreciate your time. Take care.
Thank you. The next presenter is Cheryl Leverett, Parent Coordinator, Springfield Gardens Intermediate School 59.
Good evening. Can you hear me?
Yes, thank you.
My name is Cheryl Leverett, and I am the Parent Coordinator at IS 59, located in School District 29 at 132-55 Ridgedale Street in Springfield Gardens, New York. Thank you for allowing me to say thank you publicly to the New York City Health and Hospital System for our past and continued partnership, which began in 2015 during my planning and coordination of our second annual Community Health Educational and Employment Resources Fair. My longtime contact over the years has primarily been with Ms. Claudia Hayward, who, along with several others from Queen's Hospital, have collaborated with us during the fairs to provide blood pressure screenings to the roughly 1,200 families who have joined us over the years during our annual community-wide fairs. I am now not only continuing to stay in touch with Ms. Hayward, but have only this year begun communicating and planning with Ms. Laura Atlas and Mr. Cleon Edwards, who invited me here this evening, as we schedule a mobile unit visit for our upcoming annual fair. After an unavoidable 2-year hiatus, the fair is to be held once again at the school on Saturday, May 21st from 9 a.m. to 1 p.m. Typically, our fairs have been held throughout the entire first floor, the gym, the cafeteria of the school, averaging over 30 agency representatives and healthcare personnel, tabling information, also with various mobile units parked in front of the building. But this year, we hope, weather permitting, to hold the event in our spacious, well-designed schoolyard. Rain or shine, though, we are prepared to host the fair outdoors and indoors, and all are welcome. As the past couple of years have demonstrated, access to quality and timely health care is of vital importance, especially in certain underserved areas. Therefore, we truly appreciate experiencing the diversified services that the New York City Health and Hospital System provide by having them come directly to us, to our neighborhood. On behalf of the entire IS 59 school community, I say thank you for all that you do in the area of community healthcare outreach. And we sincerely hope that we will benefit from even more opportunities to partner with you. Best of health to you all, and perhaps we will see you if you decide to stop by on Saturday, May 21st. Thank you.
Thank you very much. The next presenter is Diane Thompson, Development Manager, Afro Latin Jazz Alliance. Star 6, unmute, please. All right, we'll come back, and the next presenter would be Dr. Matthew Kusher, Medical Director, Plaza del Sol. I hear someone. Star 6, Dr. Kusher? Okay, how about,
Good evening. No, good evening, ma'am. Can you hear me now?
yes, I can. You're not
This-
popping up yet. So
Good evening.
okay.
This is Dr. Matthew Kusher. I'm just on the phone. This is Dr. Matthew Kusher calling from Plaza del Sol Urban Health Plan. So I'm calling today because I do appreciate what Elmhurst Hospital has been doing over the past 2 years. We at Plaza del Sol, located in Corona, Queens, an FQHC that is serving the same patients that Elmhurst Hospital is serving, serves as a safety net for the safety net. During the pandemic of 2020, we did not close. We were servicing the same patients and trying to do our best, along with the hospital, to take care of as many of those patients as we could. But the pandemic is not over. As illustrated by the Omicron surge in December and January, and by the continued production of new variants, this pandemic is not over. And my fear is that we are not yet still prepared for the fact that this is going to continue. COVID is not going to go away. The wishful thinking that we've had over the last 2 years that it was going to go away, that somehow vaccination was going to get us out, it has not proven to be the case. While vaccination certainly has reduced the amount of death, morbidity, and mortality as related to the infection, it has not stopped the surges of infection and the reduction of our staff, both my staff and your staff, causing delays in care and issues in terms of coordination of care. For example, the referrals department in Elmhurst Hospital had to be shut down because all of the employees essentially needed to be reassigned to other duties because of the surge for Omicron. That led to delays in care, in specialty care, for patients that can't otherwise obtain it. I fear that we are not all realizing the fact that this is going to continue and that we need to be prepared come the fall for another huge surge that is going to affect all of us, my health center, and both Elmhurst Hospital and Queens Hospital Center. So I urge all of us to keep our guards up and to be prepared for the fact that we need to be able to maintain services for patients that don't have access in other places, even while we're going through continued surges. I do appreciate all of Elmhurst's work. They do good work for our patients, and I appreciate that very much. And that's why I'd like to see them continue to operate at most optimal capacity. Thank you so much.
Thank you for your comments. The next presenter is Father Manuel Rodriguez, a priest of Our Lady of Sorrow Church. Father, are you there? Star 6. Okay, we'll move ahead and then come back. The next presenter is Leslie Petersell-Belenich.
Hi, thank you so much. My name is Leslie Petersell-Belenich. I'm a New York resident, specifically in Nyack, New York. Co-owner of New York Boat Charter and proud mother, wife, and caregiver to my husband, Captain Rob, who suffered 18 years with a very rare liver disease, primary sclerosing cholangitis. We knew he would need a transplant when he was diagnosed in 2003. I didn't really learn until, as he got sicker, we realized that the organ donor higher, and there were many more people in need of transplants than those organ donor registration list. So we did our research. Luckily, our insurance covered us beyond New York State, and we ended up relocating for a year during COVID. We left March 2020 to Florida, where he ultimately had his liver transplant at the Mayo Clinic in Jacksonville, Florida. While I wrote a book entitled Saved by a Stranger, which is behind me right here. And I wrote it for 3 reasons. Number 1, to give hope to people like us who were on the transplant list, feel hopeless. But these stories that I heard from so many transplant survivors were so incredible that I wanted the world to know about them. So this book is not just about our story, but I have interviews from 15 other liver and kidney transplant survivors, as well as organ procurement coordinators within the Mayo Clinic and doctors, because I really wanted to encourage organ donor registration and break down the myths and misconceptions people have, which scares them. And I think if you understand the process and you understand and you get inspired by stories, you're more likely to register. And the third reason was to encourage transplant centers that perform transplants to have regular support group meetings, which was vital for us. We were with Montefiore. I'm not sure how many centers do, but I do know that at Clinic, it's led by a social worker, and it's been invaluable. So thank you, Live On New York, for all the work that they do as one of our OPO is what we call it. And I'm just out here advocating for transplant patients and families. And thank you.
Thank you, and thank you for your message. And we're going to try to return to Father Manuel Rodriguez, the priest at Our Lady of Sorrow Church. Father, I believe you are here. Star 6.
Good evening, everybody.
Oh.
This is Father Manuel Rodriguez from Our Lady of Sorrows Church in Corona, New York. I am very pleased to share my remarks concerning our relation with Elmhurst Hospital and New York Health and Hospitals as well. Very grateful for the support and the great collaboration that we always receive from our dear friend Helen Arteaga Landaverde and her staff at Elmhurst. We are really blessed with this working relationship and this support. I myself can testify of the tremendous support that we receive from Elmhurst anytime we need. In particular, you know, I have been always very amazed concerning the quick response I always receive anytime I reach out to Elmhurst concerning some difficult situations affecting my parishioners. Recently, I had a situation with a lady that was in desperate need of hospice care. And I contacted directly Ms. Landaverde, Ms. Arteaga Landaverde, and she personally took care of it. I also, last year, had a very difficult situation with a parishioner affected by severe mental health issues. And I didn't know that Elmhurst holds such a well-equipped and highly developed mental health department. I had the opportunity to personally visit this mental health area in Elmhurst, and I was struck with what I saw. You know, it was amazing how what a wonderful job the medical personnel there does for all these patients, mental health patients that are in deep need of assistance. My parishioner, also was telling me how supported he felt, and how much everything that he found there helped him overcoming these difficulties that he was experiencing at the time. Also, a few months ago, I had another situation with a young man that didn't have proper medical health coverage, and I always received the same attention, the same cooperation as in the case of patients with appropriate coverage. So I'm very happy and grateful, and I really can testify of the impact, the positive impact Elmhurst Hospital and its leadership have in our community, which is, as you know, a community composed mainly by people really in deep need of medical assistance. And I think that Elmhurst Hospital is making the difference in all this area of Queens, Corona, Jackson Heights, and Elmhurst. So thank you so much for this opportunity. And in particular, thank you so much for Helen and her wonderful staff for all they do every single day to help our people. Thank you so much.
Thank you very much. Our next presenter is Samantha, representing Assembly Member Catalina Cruz.
Hello, everybody. Happy Mother's Day. My name is Samantha. I'm representing the office of Assembly Catalina Cruz. I'm a constituent liaison, and she has regarded to say that she has the honor of representing the neighbors of Corona, Jackson Heights, and Elmhurst. It is always a pleasure to work with the Elmhurst Hospital. Assemblywoman Catalina Cruz and the majority of our staff get their health care at Elmhurst. We have partnered numerous times to bring much needed information and resources to our community, whether it's in the form of a virtual town hall on women's health or bringing up pop-up COVID-19 testing sites to our office, or even a shredding event to the neighborhood. The Assemblywoman is proud to work with the incredible hospital that is Elmhurst Hospital. On behalf of the office, a special and a warm shout out to all of the folks that make Elmhurst great, the nurses, doctors, admin staff, and especially Atia. Please feel free to get in touch with us. The office of Assemblywoman Catalina Cruz is located at 4140 Junction Boulevard in Corona. Thank you.
I want to thank you all very much for participating tonight and for sharing your comments. As you all recognize, we are your public hospital, and we really appreciate all the time and effort that you give to the system and for taking the time this evening. So thank you again, and good night.
This meeting is no longer being recorded.
Good evening.
Good night.